It is fall 2025. It is open enrollment for 2026. Welcome to your UC Medical Plans and overview for active employees. My name is Garen Solbach. I'm one of the two healthcare facilitators at UC Davis. Nick Robledo and I are the two people at UC Davis who specialize in the health plans. Nick Robledo updated the slides today. I'll be your presenter, but we normally troubleshoot the use of UC health plans and coordinate them with Medicare. So we know a lot about the plans. We know a lot about enrollment and coordination with Medicare for employees and retirees. We can help you understand your retiree health insurance future if you work here long enough. And we can help you if you are having problems with your health plan that you cannot resolve with a phone call to that plan. Because we work on the plans so much, we know a lot about them. So I'm going to try to share some of the things that we've gleaned from the plans over the years, as well as try to interpret some of the changes for the future as we go through this presentation. Let's talk about what we're going to talk about. Well, we're going to talk about your medical plan options, HMO, PPO, when you can make changes, how to know what plans are available where, etc. And I want to point out that anytime you see light blue text on these slides, that is to call out any changes for next year. We're trying to interpret any changes that UCOP has given us a heads up about in light blue so that you know what the changes are for 2026. Then we'll get into the prepaid medical plans, the HMOs, and we'll break down their medical coverage, their pharmacy benefits, their behavioral health benefits. Then we'll do the same with the PPO plans, medical, pharmacy, mental health. Then we'll do a quick compare and contrast on those two PPO plans, and then we will conclude. That's the plan. Let's talk about the options that you have as a UC employee. We are actually lucky to have as many medical plan choices as we do, because as you'll find out with some of these plans, geography is destiny, and we're in California. UC's menu of options include 2 HMO plans and 2 PPO plans. PPO plans are generally available everywhere, but HMOs, not so much. HMOs are only available in urban California. In fact, across the United States, most people who have health insurance through an employer, their coverage is PPO coverage because HMOs are only available in the most urban parts of the United States. And at UC, we only contract with HMOs in California, and HMOs are only available in about half of California counties. So you might be wondering, how do you know whether an HMO is available where you are? Well, generally, if you're in an urban part of California, you're going to be able to choose an HMO. But if you're not, then you might wonder, if you want to understand what plans are available where, then you can use the Medical Plan Availability Tool, which is an Excel spreadsheet on the UC Davis Healthcare Facilitator Program website. Download the availability tool, and again, it's an Excel spreadsheet, so if you need to have Excel or an Excel viewer, you'll be able to punch in a zip code and an overlapping matching county, and the tool will tell you whether an HMO is available there. If you put 95616 Davis, California, you're going to find, the HMOs are there, of course. But if you get a little more remote, let's say you put in a zip code for Chico, California, or Eureka, then you're not going to find any HMOs. The example here's a little snip of the availability tool. Here we have a zip code 95076. That is a zip code in Monterey County. And you will see that there are no health net plans available, but there is Kaiser in Monterey County if you don't have Medicare. So the tool will help you understand how far away from urban California can you move and still retain HMO availability. Say you are in the Davis-Sacramento area. We have put together a cheat sheet for you called More on UC Medical Plans. It's not more on, it's More on UC Medical Plans. And there's an HMO side and a PPO side to this document. And what we're trying to do here is give you a little cheat sheet that makes it clear which medical groups are available through which HMOs in the Davis-Sacramento area. Likewise, what health systems, what hospitals are available through the PPOs on the PPO side. Now, for a detailed search, or if you're not in the Davis-Sacramento area, I mean, UC Davis has employees in all California counties and really all over the world. If you need to do a more detailed search, start at hr.ucdavis.edu/HCF, as in Healthcare Facilitator, hashtag search. If you add the hashtag search there, it will take you to the part of our website that lets you jump off to the searches for the HMO and PPO medical providers. Let's talk a little bit about the prepaid medical plans, the HMOs. HMO stands for Health Maintenance Organization. So you might be wondering, what is the organization? An organization is a medical group. It's a health system. And I want you to think of HMOs as an insurance arrangement where an organization is prepaid to maintain your health. HMOs are prepaid medical plans where a medical group is prepaid to take care of you. We offer two HMOs, one through HealthNet called UC Blue and Gold HMO, and the other is the original HMO, Kaiser Permanente. Before we get into the PPOs, I want to point out a big change for 2026 that you may have heard about already. We've been contracting with Anthem Blue Cross and Blue Shield of California over the years, most recently Anthem Blue Cross. Well, we're switching back from Anthem Blue Cross back to Blue Shield of California effective 1/1/2026. And as we do that, UC is consolidating two of our PPO plans into one. If you have CORE or you have UC Health Savings Plan, these are two Anthem Blue Cross PPOs that are disappearing for next year. They are being merged and being replaced by a new PPO called Health Savings Plus. With this change, we are down to two PPOs now, UC Care and the brand new Health Savings Plus plan. Both of these are PPO plans. Both of these will be administered through Blue Shield of California next year. And both are insurance arrangements where you can go to any provider, theoretically, but you are financially advantaged if you use a preferred provider. PPO stands for Preferred Provider Organization. It's an insurance arrangement where if you use a provider that has a contract with your plan, a contract with Blue Shield of California, you will have better benefits. If you use a provider that does not contract with Blue Shield of California, well, you're going to pay a whole lot more. So you are financially incentivized to use preferred providers. PPO, Preferred Provider Organization. Make sure to use preferred providers to protect your wallet when you have one of these types of health insurance. Before we get into more detail about the HMOs and PPOs, let's talk about when you can change plans as a UC employee. Well, UC Path is obviously going to let you choose plans when you're a new employee. That's a time when you have 31 days to make a choice. It's called your PIE, or Period of Initial Eligibility, or PI period. Whatever you want to call it, new employees have 31 days to choose plans. But did you know that you also have a 31-day PIE to change medical plans if you move outside your plan's service area? For example, let's say you've chosen an HMO and you have HealthNet or Kaiser, but you're going to be spending a lot of time on a research project in, I don't know, Weed, California, way up north where there are no HMOs. If you will be outside the service area of an HMO for more than 2 months, you are required to change medical plans to something that's going to cover you comprehensively. So understand that UC Path will let you change from your HMO to a PPO if you're going to move to a rural area or out of state. You must take action within 31 days of the move. And when you return to your original HMO service area, if you do, you have a choice. You can either switch back to your original HMO or just retain the PPO plan that you've had while you're outside urban California. Another opportunity to change medical plans during the year is when you acquire a newly eligible family member. So that means that if you marry or if you have a baby or you adopt a child, these are opportunities not only for you to enroll your new family member. Again, you have 31 calendar days to make that choice, to make that enrollment. But you would also have the opportunity to change plans, usually the first of the following month after adding that new family member. It might be handy to be able to change plans after you marry your new spouse. Maybe they really, really want access to a certain doctor that they can't access through your current plan. Well, maybe you could change plans to make your new spouse happy. Of course, these two options also tell you that if you are truly, truly incentivized to change medical plans mid-year without waiting for open enrollment, you might consider moving or marrying or adopting a child to open up that window of opportunity to change that medical plan if you just can't wait for open enrollment. Of course, another opportunity to enroll, let's say you had opted out of UC coverage because you got a better deal through your spouse's coverage. That happens. You might get a better deal elsewhere. You might not need UC medical. You can selectively choose to enroll in or opt out of medical, dental, vision, etc. Let's say you're opted out of UC medical. You just have the dental and vision because you're covered by your spouse, but your spouse retires or your spouse gets laid off or something like that. UC Path will allow you to enroll in a medical plan mid-year and enroll your covered family members that need covering if you experience an involuntary loss of other coverage. And you might be thinking, well, what if my spouse retires? That's a voluntary action. It is a voluntary action, but UC considers the loss of the coverage to be involuntary when you lose coverage due to somebody's retirement. So if you do experience an involuntary loss, you're going to need to get in touch with UC Path within 31 calendar days as of the date of the loss, and you're going to need to be able to prove that loss with a letter from that employer documenting who is losing what coverage and when. Of course, open enrollment is your annual fall opportunity to make changes to your health plans through UC Path. Open enrollment is generally the last Thursday in October through the last Friday before Thanksgiving in November. It's usually about a 3-week period. This year, open enrollment will be Thursday, October 30th through Friday, November 21st at 5 p.m. If you make an open enrollment change during open enrollment, you're going to be using UC Path. Any change that you make will be effective January 1st, 2026. Now, something to know about UC Path. There's a new feature that allows you to make multiple open enrollment changes per day. What I mean by this is that in the past, if you signed into UC Path during open enrollment and you made a change, you couldn't go back in during the same day and make any further changes. Well, that's changing. This open enrollment for 2026, yes, you can go into UC Path multiple times per day as you wish to make open enrollment changes. I also want to point out that UC Path should accurately reflect your medical plan rates, but the booklets that you get in the mail from UC for open enrollment can be wrong if you are a UC Davis or A&R employee. The rate charts that you see on UC Net can also be wrong, but the rates on UC Path and the rates on ucdavis.edu, the UC Davis website, will be correct for UC Davis and A&R employees. The general rates you see in the printed materials are not custom for UC Davis, and UC Davis does have custom rates because the UC Davis Medical Group subsidizes the UC Blue and Gold HMO, the HealthNet HMO premiums. They do that historically because UC Davis Health eliminated the Western Health Advantage HMO. You may never have heard of Western Health Advantage, but just take my word for it. UC used to offer another HMO through Western Health Advantage that was owned by UC Davis, partially owned by UC Davis, but we walked away from that plan when we were losing money. As a consequence, that eliminated an inexpensive HMO choice for Davis employees. So UC Davis Medical Group stepped up to subsidize those rates to be as equitable to UC Davis employees as possible. Now, if you are a UC employee that does not work for UC Davis, your rates are probably correct on UC Path, on your open enrollment mailing materials that you get in the mail, and on UC Net. There are some general things about UC medical plans that I want you to understand as we talk about the HMOs and PPOs. First of all, you don't have to worry about pre-existing conditions exclusions in any of our medical plan contracts, even before the Affordable Care Act, Obamacare. UC has never included pre-existing conditions exclusions. We've never rejected people because they were already sick from our medical plans, so you don't have to worry about any of that. Yes, you can feel free to change between medical plans, even if you have cancer, even if you have diabetes, even if you have halitosis, whatever. Something else, you need to be thinking about whether you can be double covered by health insurance through yourself and a spouse if you have access to multiple sources of coverage. Okay, you need to understand that you cannot have UC sponsored double coverage. UC will not pay twice to cover anybody. So if you are married to another UC employee, you have to choose between your coverage or their coverage. Two UC employees cannot double cover each other. Or let's say you're married to a UC retiree. They can't cover you while you cover you. No, UC cannot pay twice. That is not to say that you cannot have double coverage. You certainly can, as long as UC is not paying twice. As long as UC is paying once, that's fine. But if you are double covered, let's say you're covered with UC as an employee, but you're also covered by your spouse, that may lead you to wonder which medical plan is primary and which is secondary. And let me tell you, this is not your choice. There are a set of rules around what plan pays first and what plan pays second that are established by the insurance industry and law. You don't get to choose. Okay, so understand that the employee's plan is primary for the employee. If the employee is covered by a spouse who works someplace else, then they're covered as a dependent, and that dependent coverage is secondary. Okay, so the employee's plan is primary. The coverage they get as somebody's dependent is secondary. Well, you might be wondering about children. Children could be double covered by both parents. One who works through UC gets coverage through UC, and one who gets coverage through another employer. Those children have primary insurance based upon what's called the birthday rule. We call it the birthday rule because the parent whose birthday is earlier in the year is the parent whose insurance is primary. Okay, it's not the older parent, it's the parent whose birthday is earlier in the year. So my wife and I, we double cover our children with our medical plans. My wife does not work for UC, but of course I work for UC Davis. Well, my birthday is in September. My wife's is in July. That means that because my wife's July birthday is before my September birthday, her coverage is primary for the kids. So keep that in mind. For me, my coverage through UC is primary, and my coverage through my wife is secondary. For my wife, her coverage through her employer is primary for her. Her UC Davis coverage is secondary because she gets it as my dependent. And for our double covered children, my wife's coverage is primary because of the birthday rule, and my coverage is secondary on our kids. That's how it works. Something else you need to understand is that when you enroll family members through UC, UC will not at first ask for birth certificates and marriage certificates and that kind of thing. Please do not wait to enroll your new baby, for example, until they get a Social Security number. That is not necessary. You don't have to wait for a marriage certificate to enroll your new spouse. You just enroll them through UC Path in a timely manner during your PIE, your 31-day window of opportunity, or during open enrollment. But don't be surprised when 2 or 3 months later, you are contacted by a company called Unify HR. Unify HR is a third-party vendor that UC contracts with to verify the eligibility of our family members. It's Unify HR that might ask for marriage certificates and birth certificates and tax documents and that kind of thing. So when you see Unify HR, you need to pay serious attention and take action to supply whatever they need. And once you do that, don't be surprised if you are asked again every so many years. Every 3 years or so, UC may ask Unify HR to re-verify your family members. Why? Because we've had way too many employees fail to disenroll their ex-spouses, and we've spent way too much money on ex-spouses' health coverage, for example. So Unify HR, if you get anything from them in the mail or by email or whatever, it will be co-branded with University of California logos, but this is a very important company to pay attention to. If you get anything in the mail from Unify HR, jump on it. Other things to know about UC medical plans in general: preventive care is generally provided at no cost to you. Preventive care is care that is recommended by the U.S. Preventive Services Task Force and involves things like physical exams and immunizations and preventive blood work and colonoscopies and mammograms and that kind of thing. And if it is billed perfectly, and if you are perfectly healthy, then preventive care is generally provided at no cost to you. But I got to warn you, if they find anything wrong with you during preventive care, then there may be a portion of that care that you have to pay for. You know, only perfectly healthy people get their preventive care paid for at 100%. So just be aware of that. But in order to incentivize you to get that preventive care, to catch issues with your health early when they're better treated, we want to encourage you to get that care by making it free whenever we can. Something else to know: medical benefits may be separate from mental health benefits, and pharmacy benefits may be completely different than the medical coverage that you might be expecting. Insurance companies tend to compartmentalize things in order to take best advantage of different strengths of different parts of insurance companies' options. So this will become more obvious as we go through the plans in more detail, but don't be surprised when there are separate vendors and separate styles of coverage for different types of benefits. You'll see what I mean as we go along. But regardless of anything you hear me say during this presentation or anything you see on these screens, if you want to reference the coverage details, if you want to see your plan's Bible, you want to see the plan's booklet. Plan booklets, also known as evidence of coverage documents or summary plan descriptions. These plan booklets will tell you what is covered, what is not covered, how to use the plan, how to file grievances and appeals and that kind of thing. These documents are very, very important. And you'll want to review those plan booklets as you choose between the plans and as you use the plans. You're going to find those plans on the UC Open Enrollment website. ucal.us/OE is an internet shortcut to the UCNet Open Enrollment website. But you can also go to the UC Davis Healthcare Facilitator Program site, where you linked to this presentation. Look in the menu and click on the fine print, where to find health insurance coverage details. And on the fine print page, we're going to link you to the details on the health plans. We'll also try to get you to health plan prior authorization requirements, medical management requirements, those kinds of things on the fine print page. So remember, if you want detail about these plans, reference the plan booklet. It is your plan Bible. Something general I want to call out about the UC medical plans for 2026 are weight loss medication coverage changes. Now, if you are a retiree with Medicare and you've stumbled onto this presentation, understand that Medicare still does not cover weight loss medications unless you have a comorbidity like type 2 diabetes. But what I'm talking about for employee medical plans is that the weight loss coverage changes are for GLP-1s such that you would be limited to a BMI, a body mass index of at least 40 in order to get a GLP-1 weight loss medication covered without a comorbidity. Now, there are exceptions for those who are continuing a course of treatment that has already been covered by your plan, and you continue with that plan. But if you're somebody who doesn't have type 2 diabetes or some other type of comorbidity, you're going to have morbid obesity. You're going to have a BMI of at least 40 to get that GLP-1 covered. Of course, UC medical plans will continue to cover medications for weight loss if you have a medical need such as type 2 diabetes. So if you have something other than the need for weight loss, you're likely to get these medications covered. But if you don't have a comorbidity, you're going to have that BMI of 40 or greater. So that's something that's new for all the UC employee medical plans for 2026. In general, those were things you need to know. Now let's get into more specifics about the HMOs next.